I will post this to the same location that the Zoom link is. So anybody who didn't get a chance to see it today will see it later. Like I said, it's going to be short and sweet because I'm just going to basically go over what kind of assignments you're going to have and what we'll be doing. We'll go ahead and shoot into the modules here. And just kind of go through real quick. Here is the orientation, objectives, and plan. And not much to tell you on that slide there. This is the orientation tip for today. Like I said, this is where I'll post the recording afterwards, after I record it. Syllabus acknowledgement, you guys have done this for every other course, have you not? This basically just means you've gone in and you've read the syllabus. The syllabus is posted right here. After that, you take a quiz. Basically, the quiz just says, did you read the syllabus, yes or no? Hopefully you'll say yes. So that's all there is to the syllabus acknowledgement. You're going to do that for every course because you have to read the syllabus for every course. Did you want to go through and look at the syllabus at all?
Hey, Bryce, maybe you can show them the grade breakdown in the syllabus.
Okay, doke. Move things around a little bit here. Here we go. And here is the syllabus. There's a little introduction, and my name is misspelled, so I'll have to fix that. Me, Danielle, and here are basically the subjects that we are going to be teaching. Now, one of the things I have in the first modules is a little video that explains concepts. We're not, if you go to medical school and they'll teach you, this is the heart, this is the lungs, this is the kidneys. We're getting away from that model in nursing and we're teaching concepts. And you will see as time goes by that these concepts we're teaching are a lot closer and a lot more similar to what we do as a nurse and what we call nursing diagnoses. For example, we don't, as a nurse, we don't diagnose somebody with a lung disease like COPD. We look at the patient and we see that they are not breathing properly and we treat their oxygenation. We give them oxygen, we do what we need to do to treat the symptoms of the patient. Because I don't know if anybody's told you this or not, but the only person that can make a medical diagnosis is a medical doctor. We as nurses, we can't prescribe drugs, we can't prescribe lab tests, and we can't make a medical diagnosis. Those are the territory of the doctor. Only doctors can do that. So in order for us to do care plans and stuff, we did have to come up with some type of diagnosis for the patient so we can talk to each other and say, hey, this patient has such and such. So they came up with nursing diagnoses. But nursing diagnoses differ than medical diagnoses in the sense that we don't say this patient has pneumonia. We say this patient is having trouble with his oxygenation. This patient's having trouble with their circulation. This patient's labs are out of whack, because we as nurses treat the whole patient. So when you look at a patient, we look at the whole body and go, well, gee, we have to fix this person's oxygenation because he's turning blue. We don't really care if he's got COPD or pneumonia or COVID. We have to fix what's happening with the patient right now. And you'll get a lot more of that as we go on through the semesters and we talk about nursing diagnosis and such. So when you get into this syllabus, you're not going to see, okay, what we're going to do is we're going to talk about the lungs, we're going to talk about the heart, we're going to talk about this or that. You're going to see concepts. And concepts are oxygenation and perfusion and fluid and electrolytes. Now, we do zero in on a particular body part when we talk about these concepts. So in a sense, yes, during introduction to med surg, we're going to talk about the lungs and we're going to talk about the heart. The lungs deal a lot with oxygenation. The heart deals a lot with perfusion. And both of them have a lot to do with fluid electrolytes and acid-base balance. But that's why you're not seeing cardiac and respiratory on this syllabus, because we're trying to get away from looking at the systems and look more at the patient. Anybody have any questions on that? Because that's a pretty confusing topic right off the bat.
No questions here.
Okay, good. And it's good to kind of start there, because a lot of people get really confused when we get to nursing care plans, because they keep wanting to put medical diagnoses on there.
I've got a question.
Sure.
Just curious, is that a thing that they're doing like statewide across all nursing schools, or is that just this school implementing that right now?
It's a nationwide movement.
Interesting.
Nursing educators across the country are trying to get us away from teaching the way medical schools teach.
I like it.
I hope so. And it is something that the state and mostly the state is who we have to report to, but the state is encouraging us and basically telling us to do it. So I kind of like it too. Now, when it comes to teaching you about these different concepts, of course, we have to have examples, and that's what the exemplars are. And if you look at these exemplars, you will see that they apply to the lungs, and you can see they apply to the heart. Now, when you get into your textbook is old, and your textbook still goes by the old model. So you look at chapter 19 or chapter 20 or whatever, and it'll say lungs. And you're going to get to chapter 23. I got everything posted up on my wall. Chapter 22, and it's going to say cardiac. So your textbook still goes by the old model. But basically, these are examples we use to teach you about oxygenation and perfusion. So as you go down, you'll see the program outcomes. This is what we are hoping we get to teach you in the process of this. And here's a breakdown of the grading criteria. The weekly assignments are going to be discussions, PLQs. PLQs stand for pre-lecture quizzes. And basically those are just quizzes that you can take multiple times that apply to the reading. We just throw those in there so that to make sure that you're actually even looking at the chapters in the book. Usually just a few simple questions. You can take it 5 times, I think. And then you just get points for your highest score on whatever quiz. Discussions will be things like reading articles or reading case studies and writing a short paragraph answer on each of those questions. Support. Actually, Amanda, I'm not sure what support is. That's
That's their class they have with me.
Oh, okay. That's Amanda.
We talked about it a little bit yesterday, but remember, the class that you do with me counts for 5% of your grade in all 3 of your other classes.
Good. VSIM. VSIM is a simulation. You're going to have one VSIM for respiratory, and you're going to have another VSIM for cardiac. As a part of this syllabus, we want to make sure that you can assess somebody properly for lung sounds and such. And we also want to make sure that you can assess a patient's heart tones and heart sounds. We really don't have an opportunity to bring you into the lab and do that in person like we used to because of COVID. So we're going to be given this simulation, and the simulation will be on the computer. And that fulfills one of our requirements down below, where we have to actually do a practical for perfusion and a practical for oxygenation. So you have 2 of those this quarter, and I'll talk more about that when we get back to the module. You'll have a written paper. The written paper will be on a respiratory disease or on a cardiac disease. This paper will go through two processes. The first process it goes through is to make sure that the spelling correct, grammar is correct, and it's checked against other, it's checked against the big wide world, make sure you're just not cutting and pasting or turning somebody else's work in. We have a program that does that for us, and Amanda will be handling that. She is our paper writing expert. So she'll check and make sure the paper is put together properly. And then she passes them on to Danielle and I, and we will grade them for content to see if you're really on the mark or not. So that's your written paper. You'll have a midterm about week, when is the midterm? Week 5. Week 5, the midterm is going to cover Danielle's classes. She's teaching the first half of the quarter. She is our respiratory expert. She used to be an RT before she became a nurse. So you're going to get a lot of valuable information out of her, especially when it comes to ABGs. So she will be putting the midterm together. The second half of the quarter will be cardiac or perfusion. And the final will cover only the second half. The final is not cumulative. And I will be taking care of the final. And that gives you a total of 100%. Any questions on there? Go ahead.
Oh, I was just answering you, no.
Oh, okay. Here's how the grades break down. When you get in your grade book online in Canvas, it gives you a percentage grade. This is how it translates to a letter grade, A, B, B, etc. Thing you got to remember is you got to get 80% in the course or you do not pass. iBest support, that is Amanda's billywhack. She is there for you. She's there to help you. Take advantage of her. Sorry, Amanda, I'm throwing you under the bus. And then course policies and a lot of the stuff that you had already probably read in the student handbook.
So should we be seeing the support on our Canvas courses?
What's that?
Yes, you should. Sorry, I didn't see who was talking.
Okay, because I
Can you
don't.
say
I
your
don't-
name?
Madeline,
You don't have the support class?
not that I see, no.
Okay, I'll get you added.
Great, thank you.
I had a quick question.
Go ahead.
I was just wondering, so you said we needed an 80 or higher to pass. So if we get a 75 in the course, does that mean we just retake it, or how does that work? That might be for Amanda, I guess, to answer.
No, that's a good question. When you get below 80%, I believe we put you on probation. Yeah,
No, so if your final grade is less than 80%, you don't pass the course, and then you'll have to exit the program and wait until the course is offered again. So for example, Intro to Med Surg is only offered in fall and spring. So if you don't pass it in fall, then you have to exit the program, wait a quarter, and then re-enter. You can apply to re-enter in spring.
Okay, thank you.
I have a question too. Do you have to retake everything or you only take what you failed?
So if you passed all of the other courses, but just did not pass one, you would just retake the one that you didn't pass.
Okay, thank you.
Now, as you all probably know, we use a cohort system here where you all kind of go together as a group. So if you did wind up having to retake the course, you'd be put to you passed off to the next cohort or the cohort, two cohorts later. So I just wanted to make sure you understood that, because when I first started teaching, they kept talking about cohorts. I had no idea what the heck they were talking about. But that For example, I think your cohort is what, 322 or something?
Their cohort's 0822 because they graduate in August of 22.
822, yeah, August, and yeah, so.
And also, I just want to remind everyone, you're also called the junior cohort, your first 2 quarters. And then your second 2 quarters in the program will call you the senior cohort.
So for TCC's nursing program, you can only take a class twice. So is there like the same thing with this program, or no, you just basically keep,
3 times.
okay, thank you.
When we're done here, here's a little quiz, orientation quiz. There again, that's a freebie. You get an extra 10 points for that. And the enrollment course, this is the enrollment for VSIM. I have to make sure that code is correct.
It works.
It does? Oh, thank God. Okay, good.
We're all ahead of you.
Good. Yeah, because every quarter there's a new code, and I wasn't sure if that code was for this quarter or that code was for last quarter. And thank you, Amanda. I'm sure you're the one that
I have
updated
a
that.
question.
Yes.
So the vSIM that we're supposed to buy from the point, if it doesn't work and the system keep failing, can we get the vSIM from the bookstore? That way we're not so far behind.
Yes, you can, but make sure you can return the other one before you purchase another. Did you call the Point customer service?
I emailed them yesterday. They didn't call me the whole day. They told me they'll call me and not yet.
Okay, if you have time today, I would recommend calling them. They're more responsive on the phone.
Okay, thank you.
Okay, doke. VSIM tutorial, you'll want to go through this because it shows you how to use the VSIM. Introduction to concept-based teaching. This is just a video that I had prepared. It will go into a lot more detail as to what concept-based curriculum means. If you're curious, you can watch that. It's not a requirement. Honor lock instructions. The tests are being given at home. We use a system called Honor Lock. Did you guys cover that yesterday, Amanda?
I don't think that it did get covered, so if you could cover it, that'd be great.
Okay. Watch these 2 videos. Basically what it is Honor Lock is a system whereby when you first log in to take an exam this quarter, it's going to ask you for a picture ID. Your computer has to, number one, it has to have the Honor Lock extension downloaded and placed on your computer. So don't use a computer that's like from a company where they have the administrative processes locked out and you can't download anything. You have to be able to download the extension for Honor Lock into your computer. Also make sure if you're taking the Proctorio. Now, Proctorio is the same thing as Honor Lock, only it's for ATI only. You have to be sure you disable your Proctorio extension before you engage your Honor Lock extension. I know that's a pain, but otherwise you're going to try to log on to your exam and it's going to ask you for a code. And we can't give you that code because you can use that code to disengage Honor Lock. So if you go to get onto your test in Intro to Med Surg and it's not letting you on, make sure that your Proctorio extension is disabled. I'll just throw that out there right now. But anyway, you'll check on as a student, they'll ask for your picture ID, they'll show you to it, and you use a computer to show your environment, make sure you don't have your textbook sitting right next to you or another person. And then it monitors you as you go through the test. Now, it'll listen for things like if there's other voices talking to you, You know, if your kids run in and say, mommy, we want lunch, it's going to alert and it's going to flag it. It doesn't disqualify you or anything of that nature. It just says, here's an alert. And we can look at the alert and go, oh, that's just your kid asking for lunch and it's not a problem. So if you get a red flag in honor lock, don't worry, it doesn't mean where they're kicking you out or anything. It just means they saw something weird. If I go like this for a while and then they come back like that, honor lock will put a big flag up because, you know, I'm supposed to be working on my test. So go ahead and watch these 2 videos for honor lock and it'll answer your questions about honor lock. A lot of people were worried, oh my God, the NSA is spying on my computer. Well, this video right here tells you that no, the NSA is not spying on your computer. So, you know, everything, we've been using it, colleges are using it all across the country. If you are concerned about anybody accessing on your things on your computer that you consider sensitive, then use a different computer. But the honor lock has to be able to go in and make sure that you're not flipping over to another screen and getting answers off of Google in the middle of a test.
A quick
Any questions
question.
there? Christina.
Do you have like instructions on how to disable the Proctoro while you're doing the honor lock? Or are we supposed to like Google that? How does that work?
Proctorio, that is a really good question. Because you guys are going to be taking an ATI exam this Friday, are you not?
Yes.
Okay. Let me see if I can get that answer before Friday.
Awesome. Thank you.
And that way, yeah, I'm not sure. Maybe Bill knows, but I'll find out. I'll get the answer before Friday. And I'll let you guys
Very
know
much.
because I'm going to be proctoring the exam on Friday.
But you
Also
need the
the-
Procterio extension for Friday, so you'll have to wait to disable it until after that. I think I have the instructions for that, Bryce. I can send them to you.
Oh, great. Thank you.
Do we have instructions on how to get into the ATI? I was having difficulty getting in yesterday.
I'm gonna go over that again today at noon if you want to join the Zoom for that.
Oh, perfect. Thank you.
Also, after this meeting at 8:30, I have a question and answer time. I can also go over it at that time.
Perfect. Thank you.
There's a good question somebody brought up, Rachel. Is it okay to go somewhere else like Starbucks? I say no. The reason being is all the activity going on at Starbucks, it's going to alert and it's going to just send red flags everywhere. So you have to be someplace, plus it's going to have you show the environment. When you show the environment, there's other people around, unlocked, just going to say no. You have to be in a room by yourself, you know, with a bare desk when you take the honor lock tests. I am so looking forward to the day we can do back on campus again because it's just so much easier. Another question here, ATI is something I should have been studying for? No, ATI, has anybody, they talked to you about ATI yet? Has anybody discussed ATI with you?
Yes, they
Yeah,
did.
we had an ATI meeting yesterday, but they still need to know more
Okay.
about it.
ATI is a program that we use to judge your progress throughout the course and then customize that information to give you an NCLEX review your senior year. ATI is not part of your GPA. I want to emphasize that. It's not part of your grade. What we do is we just use it to make sure that we are doing our job and giving you the information you need to pass your NCLEX exam. The nice thing about this is after you graduate, you don't have to run out and do a Sylvan or what are the other people that do it? Other company do a NCLEX refresher course because we are giving it to you. Actually, you're paying for it. It's a part of your fees for the college. So the ATI is a complete and thorough NCLEX review, but you have to use it. That's the important thing. You're going to take tests and it's going to see, okay, you're really weak in pharmacology. And then it's going to give you pharmacology stuff to review, to bring you up. I'm getting a whole lot of chats here. What's going on?
I've got the chat. Bryce, don't worry
Okay,
about
yeah,
it.
you can handle the chats. Thank you. Anyway, the ATI is you're going to take tests and it identifies where you're weak and it gives you additional material to study so that you're nice and strong by the time you graduate and go to take your NCLEX exam. That's really what we're all shooting for, right? You want to pass your NCLEX. You don't pass your NCLEX, you don't know worky. So just be sure you take the ATI seriously and do what it says, and it will strengthen those areas in which you are weak. Any questions on the ATI? Okay. Honor lock, I just showed you frequently asked questions about honor lock there, so that'll answer all your questions about that. Moving on to the next module, this is your calendar that's in Canvas. This is a contact schedule in case you have to contact any of your instructors. Here's our emails. I will frequently post my phone number. I don't mind getting phones or text calls. I think it's in my summary. I'm not sure, but I'll make sure that my phone number is in there where you can reach it. Where was I? Going back. Okay, here we are. Zoom hours, office Zoom hours. These are the Zoom hours and the links. And everybody has it at a different time. We're still trying to figure out when Danielle will be able to do hers because she's in that graduate program. Mine are on Friday at 9 o'clock. So I will be available Friday at 9 o'clock. I'll log on. I will have the PowerPoint for that week available with me in case anybody has any questions. And Danielle will do the same thing. And Amanda is Tuesdays at 8 o'clock. If you have any questions about what she's doing in this course, which is the dosage and the iBest. So don't get on there and ask Amanda about, cardiac questions and perfusion and catheterizations, because that's not Amanda's thing. You get on and ask myself or Danielle. And then again, Danielle's teaching the first half of the course. I'm teaching the second half of the course. So it's best if you can ask the instructor that's teaching that particular class. Going back, calendar and contact info. This is just a bunch of information here on different faculty and how you can get a hold of different stuff. There is the hours, the office hours for everybody. So if you have a question for Bill, you want to hop on. Well, he's not doing that. He's not teaching anymore. But if you want to get a hold of Eileen, this will tell you when it's a good time to get a hold of Eileen. There you go. In a minute. Okay, there's my phone right there. So this one here, faculty name, best form of contact. This will have our email at Bates, and we'll have our phone numbers, and if we prefer to be called or to have a text. I mean, I hope you have that. There have been situations where people are on their way to clinical and their car breaks down. And if you can send me a text and say, I'm sitting by the side of the freeway, I greatly appreciate that. So moving on, these are the guidelines for the paper that you're going to write. Remember, that was worth 10 points. You select the topic. It's going to be either on a cardiac subject or a respiratory subject. And you select your topic. Here is the criteria and how many points you get for each of the areas. You're going to pick a disease. You're going to define that disease for us. You're going to outline the pathophysiology of that disease. And you're going to say how it affects certain populations, risk factors for the disease, how it's diagnosed, Now, when I was talking about nursing diagnoses, have you guys been exposed to nursing diagnoses at all yet?
No.
No, okay. I will show you that, since you have to have it in your paper. Teaching, what you would do for teaching the patients, medical treatments, and summary. And this explains how the paper is to be constructed. You're all familiar with APA format, right? What I did when I was in
Yes.
college is I got online and I got a sample page of APA citations, and I printed it so that I could look at the samples of what an APA format was, because that really helped me out a lot. Most of you are probably going to go on to RN program. You will be writing papers. They will be required to be in the proper format. May as well get used to it now. UniCheck is one of the programs that we use to check these papers and make sure you're just not cutting and pasting a bunch of stuff into a paper, basically. Cutting stuff out of another's paper and putting it in your paper is called plagiarism. That is an ethical violation. You can be dismissed from the course for that. If you claim any work as your own that you copied from somebody else, that's plagiarism. So that is what UniCheck does. It helps us to find. It goes out in the World Wide Web and it tracks down and makes sure you're just not cutting and pasting a bunch of stuff from somewhere else. This is where you will submit that paper when you were done. It's a 3 to 4 page paper. I mean, that's not a huge paper. And by the time you get done answering all of these different questions, you will have 3 or 4 pages. It's a pretty simple one. And then here are the topics from which you can choose. Just about everything known to man. So pick one you like and go for it. Here again is the same stuff I just went over in a rubric format. I'm thinking, Amanda, I'm going to have to put a NANDA nursing diagnosis list in this.
Yeah, that would be really helpful. I do give them some resources and support closer to the time when they're going to be writing their paper, but they also get some of that in PVR.
Okay, good, good. Because we really don't address nursing diagnoses until clinical 1. So we're going to
Well,
have
that's
to
about to change, right? Clinical 1, they won't have clinical 1 till second quarter, so.
exactly. But we know there's nowhere else in like the med surg where we do talk about medical diagnosis because it's in the chapters in the book, but we don't really focus on that until clinical 1. So we'll have to give them a little heads up on that, I guess. But now you got me thinking, okay, we're gonna have to do some changes. Okay, so that all being said, that's just the preamble stuff. Now we're getting down to the actual classes themselves. And I got to go back and change this because at the end of this right here, it should say Danielle. Week 1. Now you have 2 different instructors. We're going to do things a little differently. Danielle's going to do things a little differently than I do. That's just the nature of college. I've got 2 degrees. I've got 1 in philosophy and 1 in nursing. And every course I went to in college, every instructor did things completely different. You just get used to that. In nursing, it's not as bad. We try to introduce some uniformity and consistency between classes, but still, instructors are free to teach the way they want to teach and to assign assignments the way they want to. There's no overseeing umbrella where we have to do things the same way. So you will see a difference between the assignments that Danielle assigns, what I assign, and what Eileen assigns. So, and this is probably going to be different than what Andy and Angie did with you in fundamentals. But Danielle and I are pretty much on the same sheet of music. And each week you will be given, you'll come into a module week 1, and I will show you one of my modules the week I'm teaching too, so you can see how I do it. But you will have, the first thing will be objectives, readings, assignments, and quizzes. Now in this, hopefully we are outlining everything that we are going to do for that week. But basically, they're going to be pretty much the same between us. We're going to tell you what our objectives are. There's going to be an intro. Danielle is going to give you an intro to that week. There will be a PowerPoint slide presentation for each week. Now, Danielle is not able to be here on Tuesdays, so she is going to, as you can see, she's going to record her PowerPoint presentation and you will just have to view it. Since I'm not in the graduate program going for my doctorate, I will be available on Tuesdays, and I will do a live lecture for you guys on Tuesday, and I'll show you how that works. But for Danielle, when you get to week 1, you'll simply go in and watch her lecture on chapter 19. She will present the PowerPoint slides to you and tell you what's important and what you need to know. She will also make available the PowerPoint slide itself. And if you want to print it out, if you want to go back and review it, you can do whatever you want with that PowerPoint slide. As you can see, week 1, she's covering chapter 19 and she's covering chapter 20. So there's a PowerPoint slide and a presentation for each of those 2 chapters. The reading assignment, of course, will be chapter 19 and chapter 20. There will be a pre-lecture quiz, which will cover some questions from these chapters. And week 1, there will be some type of assignment that you have to hand in. So let me go back to the main screen here for week 1. Here will be the pre-lecture quiz. And she has 2 of them, one for the anatomy and physiology of the respiratory system, and one for upper airway disorders. She does have some information on cardiopulmonary assessment. And okay, this is going to show you lung sounds and heart sounds. Very good. Glad she's got that in there. So that's really about all I have to say about that. I'm kind of curious about the reading assignment, where that is. She said, discussion board, week 1 respiratory system. I'm trying to find that.
Which assignment are you looking for?
The discussion board. Oh, here it is. This is probably it right here. Assignment.
It looks.
Yeah. Okay, so this is going to be your reading and answer assignment. She's going to have you read the article, Blood Flow Through the Heart, and then have you submit a discussion board answer. Or here she is. She says, write out or draw the path the blood flow takes through the heart. Not sure really why she's doing that, because the heart is my area. But anyway, I'll talk to her about that. Anyway, so that is an example of week 1. Now you'll notice there's no week 2, week 3, week 4. Danielle and I inherited this class this quarter. This is the very first quarter that we've taught it. And when you inherit a class, you basically have to rebuild it for 2 reasons. 1, we do things differently than the previous instructors did. And 2, now that we're going to a concept-based curriculum, we're having to change everything from a system-based criteria to a concept-based criteria. That means we're having to redo all the slides, redo everything. So this is a work in progress. So Danielle is working on week 2, she's working on week 3, she's working on week 4. When she gets done with week 2, she will post it and it will be published here. So please be patient with us. We didn't have it all done before the class started, but we're working on it. Week 1 through 4 will be Danielle. And like I said, she's doing respiratory. Week 5, you will be handed over to me. And this is how my assignments are going to go. In week 5, I tell you that there will be a live Zoom recording every Tuesday morning at 9 a.m. So, and then there's my phone number if you ever need to contact me. And I'll show you that as we go along here. But you have a PLQ, pre-lecture quiz. You have 3 tries. There's a crash course video. Actually, I'm going to go back and do it in the module so I can show you each module as we go along. Week 5 is a review of the heart, the anatomy and physiology. Crash course is a video series on YouTube. This guy is absolutely hilarious. He does a wonderful review of the body systems. Some of you may have already seen him. You might have had him in some other courses. He's very good. It's a really good way to get a review of a body system. And then at 9 o'clock on Tuesday of that week, so I believe that's 10/26, I will connect to this link here and I will present the PowerPoint slides to you. And you will be online and you can ask questions if you want to. I will record this session and about an hour later, I will repost it right here. So if you couldn't be here for the live presentation, you still get to see the live presentation. And then below that are the actual PowerPoint slides that I use in my presentation.
Hey, Bryce, can I ask a question really quick?
Sure can.
Before week 5, you'll still have your open office hours on Fridays at 9, right?
I will.
Okay.
I was going to show you something if my PowerPoint comes up. I always like to download the PowerPoint and then bring it up. It's a lot faster. If you bring your PowerPoint slides up in Canvas, it seems to take Canvas forever to get them loaded. Okay, I'm going to skip that for now and I'll show you. I'll bring it up directly. Whoops, sorry. Too far. Okay, so the PowerPoint slides are in there. And I'm going to show you something that I do with the PowerPoint slides that people seem to like. Here's the pre-lecture quiz that you will take on the cardiac system. This, of course, will be pertain to chapter 22, which is the chapter for the physiology. And then the assignment is going to be a case study. I like case studies because I think they are closer to what you'll see on your NCLEX test questions. But in the case study, and I'll bring it up here and show you, the case study basically just gives you a scenario. 54-year-old man is in your unit. He has, okay, here's the case. Here we have a 67-year-old man who just returned from a heart catheterization lab. And it's going to give you information on him, his vital signs, his lab tests, his signs and symptoms. And then at the bottom, there's just going to be a couple questions you need to answer. Now, what I want from each of these answers is a good sized paragraph. I say minimum of 75 words. 75 words is really just a short paragraph. You don't have to write an entire dissertation for each of these answers, but I don't want a 1-sentence or a 2-sentence answer. Okay. Very much the same situation with Danielle and her studies as well. So that explains the classes. Are there any questions? I know we got a bunch of chats up here. Let me just zip through real quick and see if there's anything that.
Question. So a lot of those due dates say that they're due on October 5th, and you're talking about a 5th week class. Are you going to be going through and changing the due dates?
A 6-week class?
You said that you were just talking about week 5 classes, but those due dates are saying October 5th.
Yeah, week 5 is October 26th. Our weeks run from Tuesday to the following Tuesday. And the reason we do that is because all your papers and stuff will be due on Tuesday of the following week at 7 a.m.
So my question is, for assignments for week 5, your pre-lecture quiz on the cardiac system is due on October 5th. So we are to do the week 5
Oh, okay,
assignments prior to
that's-
week 5?
That's my mistake. I will fix that.
Okay, thank you.
Yeah. Okay, let me make a little note right here. I guess the PLQs is one of the things I missed. I think I got the due dates right on everything. See, what we do with a lot of this stuff is we're pulling stuff in from previous quarters, and we have to change the due dates, and sometimes I miss one.
That's understandable.
It's like herding kittens. If any of you have the workbook and you want to do the questions in the workbook, here are the answers to the questions in the workbook. Workbook answer keys. And these are the answers to the quiz bank in the workbook. So got all that stuff down there if you need it. Any questions on this class that you can think of at this point? All right, the chats went from 15 down to 3. Good job, Amanda. Let me see. Do we want, let me just do a real quick, I'm going to leave the student view right now. I'm going to do a real quick, what is a nursing diagnosis?
Bryce, can I interject something really quickly to clarify? The
Definitely.
workbook is optional. You don't have any assignments assigned in it. It's only if you want to buy it to study extra.
Yes. I will take this document and I will put it over in our introduction to med-surg class. But it takes Canvas forever to bring things up. Here we go. This is the latest. NANDA is the organization that approves nursing diagnoses. The latest we have is 2018 to 2020. And okay. This is crazy. Let me see if I can just download it and bring it up.
Before we begin this, can I ask something?
Here we go. Oh, this is much faster. Okay. Yeah, go ahead.
Are you able to click on grades just so that I can review something?
If you click on grades, it's going to show everyone. So I don't think.
Oh, okay.
Yeah, no.
So on my screen, I'm seeing something that was due May 20. I'm seeing two things that are due May 25th. It says Carl Shapiro 50 points and then it shows missing. What is that?
We will fix
okay.
those.
The VSIMs probably need to have their due date updated.
Okay. Just making sure.
That's okay. Good.
Thank you.
Yeah, because I just took those VSIMs from previous classes and popped them in there real quick. So yeah, I'm glad you pointed that out. I need to go back and look at the due dates for those. So moving on, here is what is a definition of a nursing diagnosis? Here it is right here. This is where we as nurses use our clinical judgment to respond to health conditions in our patients. That's different than a medical diagnosis where we are actually diagnosing a pathophysiology. If we scoot down here, you will see that These are what nursing diagnoses look like.
Is there
Um,
something
I
that
can't
has to be on the screen?
Yeah, because it's blank.
Oh, okay. Let me stop the sharing. Got a new share here. There we go. Even told me it's got a new share.
There you go.
You see it?
Yes.
Okay. I'm going to zip down to, for example, dealing with cardiovascular. Now you notice under cardiovascular, our nursing diagnoses are not congestive heart failure, myocardial infarction, et cetera. We are looking at the patient's symptoms. If someone has a bad heart, they may have an intolerance for an activity. They try to get out of bed, they're short of breath, they don't have the energy to do it. Decreased cardiac output. They try to sit up and they get dizzy and fall down. They may be at risk for decreased cardiac output. Maybe they just came back from the cardiac lab. I don't want to sit them up and find out if he's got decreased cardiac output. So they're at risk for the decreased cardiac output. A risk for unstable blood pressure. Ineffective peripheral tissue perfusion. You look at their fingers and their fingers are blue. So you can see nursing diagnosis focus more on the symptoms of the patient and not so much on the actual pathophysiologies. Now we have to look and we have to study the patient's pathophysiologies in order to understand, okay, he just came back from the cath lab. Well, I have to understand how the heart works. And I have to understand what a heart catheterization is in order for me to understand why that post-cath patient is at risk for decreased cardiac output. So in other words, you have two jobs. You have to know everything the doctor knows and you have to know everything the nurse has to know too. Doesn't that make you feel better? But as you can see, when we talk about concepts, we're talking about perfusion, how are we getting blood through the body? These nursing diagnoses are very similar to the concepts. We have ventilation, we have perfusion. You even see those concepts in the nursing diagnoses. Perfusion, 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 perfusion. So that's what a nursing diagnosis is. And so when it comes to, say you want to do your paper on congestive heart failure, when you get to the point where it says you need 3 nursing diagnoses for this patient's congestive heart failure, you'll want to come to this list and pick out 3 things that you think apply to that person's congestive heart failure. And once you look at the disease and once you see how it affects their heart, these will just pop right out at you. You'll just be able to go, oh yeah, that one, that one, that one, that one. And the same is true when later on, when we start getting to clinicals, and you have to start filling out nursing care plans. A nursing care plan is when you take a sheet, you put the nursing diagnosis at the top, and then below that, you put what interventions you are going to use as a nurse to make this patient better. And nursing care plans are something that you are going to see throughout your entire nursing education and throughout your entire nursing career. So you'll be beat over the head with nursing care plans ad nauseum for the rest of your career, especially in extended care facilities. They really emphasize the nursing care plans a lot, not so much in the hospital. Any questions on that?
Where can we find that one more time?
Excuse me. I'm going to take this sheet and I'm going to upload it and I'm going to put it in your, I'm going to put it in the Canvas module. Let me go back to the Canvas module. Okay. So, oh, here we go. We can go right here. Okay, good. I'm going to go back to Introduction to Med-Surg right here. Go into modules. And since this is a requirement for your paper, I'm going to put it right here. I'll put it at the bottom right here on the list. And by all means, if you have any questions on how to put nursing diagnosis into your written paper, please email me, text me, call me, whatever you need to do, and I'd be more than happy to explain that to you. Any questions?
No questions here.
Okay. Stop the share. Okay, this I'm just going to throw the floor open for any questions you may have on Intro to Med-Surg, first year as a nursing student here.
So by sending you like our paper maybe beforehand, like you were just saying, you would go over that and see if we're on the right track, or for the diagnosis, or no?
Good question. Amanda, what do you think?
So you get your paper vetted a lot through me before it gets to the final draft that you'll submit to Intro to Med-Surg. But I think if you brought your paper to open office hours with Bryce and said, hey, these are the nursing diagnoses I have for my topic, and this is how they're related, and asked him to give you feedback on if that's correct, Bryce, I'm sure you would be willing to do that.
Most definitely.
Okay.
I don't think we really have time, if everybody wanted to say, okay, here's the paper I'm going to hand in. Can you go over the whole thing and make sure I'm on track and everything before? But I mean, if you have sections that you're concerned about, oh, by all means, yeah, please let us know.
Hey, Bryce,
Yeah.
there's a question in the chat about your Zoom meetings. I'm not sure how to answer it. Rachel, Bryce is going to have Zoom meetings every Friday at 9 a.m. But I'm assuming the 26th is when she's asking if that's when your lectures will start. Is that what you mean, Rachel?
I will be here every Friday throughout the quarter, whether or not I'm doing the lecture for that week or not.
So, but your lectures will start week 5 for Intro to Med-Surg.
That's correct. Week 1 through 4 is Danielle, and week 5 through 10 is me. Week 9 is a freebie. That's Thanksgiving week. So you guys don't have anything week 9.
Okay, I just wanted to clarify. So whose meetings are live on Tuesday at 3?
Mine.
And
wait, no. You're not live on Tuesdays at 3, are you, Bryce?
No,
That's
Tuesday,
Danielle's time.
I'm sorry. Tuesday morning at 9 o'clock.
Wait, you have Tuesdays at 9 also?
okay, I'm confused.
Bryce, I have you
we-
down for Fridays at 9 a.m.
That's my office hours.
Oh, okay, so you want Tuesdays at 9 a.m. for your lecture,
Correct.
Okay.
but that won't start until week 5.
Correct.
Okay, so I'll update that on the Zoom.
And I believe that Danielle cannot, Tuesdays are Med-Surg day.
Danielle has open office hours Tuesdays at 3, she told me, so.
Okay. Now, when I did talk to Danielle, we felt that her doing a live class at 3 o'clock on Tuesdays was a little late, for you guys to get that information. So she thought she would just go ahead and record the classes first. And then Tuesdays at 3, when she has office hours, she has the slides available to her. And she can go through them. And if anybody has any questions on anything, you can certainly ask her at that time. I don't know if she's going to be recording the office hours or not. I normally do not record the office hours, but I do have the PowerPoint slides available. So if you missed my live lecture, You can certainly ask me any questions you want to about the PowerPoint slides. I was going to point one thing out. Let me get back in here real quick. See if I can show this to you. Now that I've figured out what I'm doing, I'm going to see if I can point something out to you. Go to modules. Down. Week 5. Oh, that's week 2. Wait a minute. I think I'm in the wrong way. Nope. Yeah. Oh, okay. I'm not in student view. That's why I've got all the other modules. Some of these we haven't published yet. But on the PowerPoint slide, I'm going to download it for a second here because I want to show you something. That way that'll bring this up much faster. Does everybody see this? I don't know what Danielle is going to do as far as a test review goes, but I don't do test reviews. What I do is, you see this little character on my PowerPoint slides. As we go through the PowerPoint slides, this little guy is going to show up on the PowerPoint slides and let you know what you need to study for the test. Does that make sense?
Don't see anything on the screen. It's just white.
Why is it not sharing? Okay, let's try this again. Oh, here we go. Oh, let's go again. There we go. Got that?
Yeah.
Yes.
Okay. When I go through my PowerPoint slides, I'm going to have a little character. And this little character I use to highlight things that you may see on the test in the future. So as you can see, I will usually bold information and then put this little character, and that tells you what you need to study for the exam. So I do that instead of doing a test review. Because the thing I don't like about test reviews is they're either too vague and you're like, well, basically you're telling me to study everything, or they're so specific that they end up giving you the answers to the exam. So I'd rather you just go back through the material, see the stuff that I highlighted, and know that that's the material you have to study for the exam. Any other questions? How are we doing on time? Ooh, boy, we're way over.
I had a question. Are there labs in this class? Like for other classes, we have groups that we attend and go to labs once a week. Are there labs in this class?
No.
Okay.
The 2 simulations are considered your hands-on.
Okay.
Any other questions?
To be clear, the simulations are the VSIMs, the virtual simulations online.
And they're online. But you have you guys done any VSIMs or ATI simulations yet? No, probably not.
No.
Okay. You'll have a patient on the computer. You have to interact with that patient. They try to make it as real life as they possibly can. A lot of people like them. Any more questions? At this point, then I will stop the recording.